Janai Hill, and this is my case reflection for biomedical ethics. My incident happened on June 6, 2021. I was experiencing chronic migraines, debilitating migraines that I wasn't able to live my daily actions. I couldn't go outside. I couldn't do anything because the migraines were so painful, and I couldn't even open my eyes. It hurt so bad. So after the fourth migraine, and no Excedrin or ibuprofen or Tylenol or Advil could help me, I decided to go see professionals. The doctor, we're going to call this Dr. George. George told me that nothing was wrong and that it was PMS. And I told him that I don't usually get migraines during my cycle. And he told me that, well, you know how women are. So I left, still with a migraine. And then I came back the next day. George was like, oh, is the migraine still bothering you? And I said yes. So he took me into the room, he took my vitals, and then he said he'll be back. George never came back, and we're going to call the nurse Anne. Anne came back and asked me if I was doing okay. She saw me squinting a lot, and she turned off the lights because she saw that I was in pain. So she continued to ask me questions, asking if I've ever felt migraines like this before. I said no. And she said, well, I'm going to take a CT of your head just to be careful. The doctor barges in and says that nothing's wrong with her head. So Anne asks, how would you know if you don't look? And he claimed that it's because usually African Americans do not have tumors or anything in their head. They're usually in their breast or anything. So Anne still took a CT of my head, and the next day she called me in and she wanted to talk about my results. So I went back in to see Anne, and George was there. And Anne was like, so you have a pineal cyst sitting in the back of your eyes. And I was like, is that what's causing the migraines? And she said, yes, that is what caused the migraines. So George apologized. He said, I'm sorry. This is a serious matter. I should have dotted all my I's and crossed all my T's. And he said it's not very common in African American women. So that's why he just blew it off. From that point on, I refused to see George as a doctor, and I continue seeing the nurse practitioner, and she's helped me tremendously through the process of getting my cyst taken care of. I still currently have it. It doesn't bother me as much. I had to go to an eye specialist who said that it is rare to find in African American women, but she wanted to make sure that the cyst wasn't causing any pressure on my eyes, and it wasn't. I have to wear glasses when I'm at work due to the lights and everything, but the prescription is so strong that I can go a couple hours without it, and then take a break from it, and then I'll have to put them right back on when I need them. This experience was very new to me because it has never happened to me in this role. It was a clear violation of justice and beneficence, because I felt like George did not have my best interests at heart. Um, it it violated all the clinic procedures. He didn't even try to see what my symptoms were. He just claimed it was PMS and that it was a woman thing and that black women can't have pineal cysts. It was hurtful. The situation affected me very much because I work in a hospital where lights and noises are everywhere, and I couldn't do what I loved. I couldn't work with the patients, and I felt like nobody was on my side and that I was making these things up because he didn't even take the time of day to look at me. I've made sure that as a person, I made sure that I am more attentive to what people are saying, especially with working with different types of patients, because any little thing that they say could be a trigger and it could be life or death. The cyst is currently not life or death, thank goodness. It is just causing some pressure. It's not cancerous or anything. It's very benign. Anne wants me to go see a neurologist, so that'll be our next step. And then we can go forward on the type of medication, whether it's medication to shrink it, or actual migraine medication. I have to go see the eye specialist every 4 months just to check to see if the cyst is causing any pressure. I just went a week ago. They said it's not, so we're doing okay. As a PA, I want to become a PA. So as a PA in the future, it just ensures me that I have to be diligent and thorough when checking my patients for diagnoses. Just because it isn't common in one ethnicity or race or gender doesn't mean it can't happen. My listening skills have improved tremendously, and my communication skills, because I feel like communication sets off a lot of things. I just said I had migraines, but I was also squinting and looking down at the floor, and thank God Anne noticed that when I walked in. So it's not just verbal communication, it's body language as well. I will make sure that in the future that I go through every check of diagnoses, just double check everything, because I don't want anybody to feel the same way I did in this situation. It was terrible. I felt like I was crazy because nobody believed that I had these cysts that when I blinked, it hurt. It felt like somebody was ripping my head in two. And I felt like nobody believed me. I couldn't do anything. We bought blackout curtains just so the sun wouldn't peek in, and then we taped the blinds on the side. That's how bad my migraines was. I'm just happy that a nurse such as Anne believed me and took the proper precautions to make sure that everything was okay.